Today we'll be talking about cellulite, a condition that affects over 90% of women. It's really pesky and hard to treat, and we're going to be talking about what causes it, what are the things that make it better or worse, and what are the treatment options available. In this particular case, we have a young lady here that has dimpling on the backside of the buttock. Cellulite can not only affect this area, it can also affect the areas of the hips, the thighs, and the buttock. Most likely it is worse around the areas that get constant compression over time, which if you think about it, is usually on the areas where you sit. The common notions that are out there that cellulite can be treated with weight loss, exercise, are partly true. However, they really don't impact the condition as much as we would like. We've had many women that come in that are fit, that are exercising every day, they're running, they're in the greatest shape of their life. However, they're still plagued by cellulite. And that's because the anatomy of cellulite is such that the skin that drapes our body, below it has a fatty layer. That fatty layer connects to the skin via these fibrous, thick cords. You can think of them as ropes that are pulling the skin to the deeper tissues. Over time, that ropey-like structure gets pulled and stretched. So what you get left with is a dimpling effect because the ropes are keeping the skin in one area while all the fat around it really pushes through. The best way to think about the anatomy of cellulite is to think of a pincushion sofa. If you notice, there's areas of skin that are pincushioned down to the deeper layers, just like a sofa would be. The areas around it are actual prolapse fat, where the fat that accumulates over time gets pushed through, and the pincushion part keeps it tethered to the deeper tissues. Over the last 20 years, there have been a number of treatments that have come out for cellulite, and they're anything from topical creams to devices that have been put out to the market, and a lot of those devices have been pulled back as they were ineffective or had too much downtime or complication. Before the procedure is I circled all the dimples so that I know how to detach that tether, but I also put arrows where the tether is coming from. So what I'm trying to do now is find the best location to insert my cannula where one insertion point can reach all the tethers together. And it looks like it's going to be from this lateral point. There it is. We use an 18 gauge needle to perforate the skin laterally. You get a little light over that piece as well. Now we're going to be numbing the path that the cannula will take. Does that hurt at all?
No, not yet.
Good. And it has a slight cutting edge on the bottom that allows us to perforate. And you can see how, because of the prior procedure, she's now much tip of the cannula that's coming under the skin. So we're doing sweeping motions to separate the dermis from all the tethers in the deeper tissue. Apply force and find a way to break it apart. The movements that break it apart are varied based on the tether. And that's why I drew the arrows prior to the procedure in order to find the best way to trach it. To have the patient sit up on their knees a little bit and see if the tethers are gone and which ones need a little more breaking. Sit up a little bit now. She's a pro. We'll have those, okay? Go back down. That are tethering. Then have the patient lay down and break the tethers apart. And then inject your filler of choice into those areas to reattach to the deeper tissues. Find the best area to insert the cannula. Most of the time it's laterally or inferior. A little lighter, please.
Oh.
I'm sorry, madam. Really good. She always does. She's a trooper.
Very tough.
Now, oftentimes I don't just do the tethers. I sort of like to detach most of the soft tissues here away from the deeper ones in a sort of block-like fashion, because that allows the buttock to reshape itself in a more natural configuration.
She's a trooper.
There it is. You need to come down here. She's probably going to need some more gauze.
Okay.
How's it feel?
I mean,
Lightheaded?
it's hurting a little.
Which part hurts, left or right?
Both.
Both? A little bit or a lot?
It's all right.
Okay. The filling material to re-inject into it and place a temporary expansion. A lot of this benefit usually happens at 6 weeks after the procedure. A lot of pain or no?
A little. Just a little.
You do. However, he has a sharp tip point that will allow us to cut the tethers. Beautiful. You done did it. Now we're going to put some Band-Aids and you're good to go. Just stand there for a second because it's going to be dripping otherwise.